Hi friends, once again welcome back to the Nurse channel. So as you all know, we have started a new series for the preparation for the upcoming AIIMS NORCET and the JIPMER examinations, and whoever didn't watch our old videos, kindly go through those videos and make use of it. So as I told in the beginning, this session also contains 15 very important questions which will make you to prepare for the upcoming NORCET examinations. Okay, so the peculiarity of this video is like I have included more picture based questions and previously asked questions also. Okay, so definitely this session will definitely will help you to prepare well, and I request everyone who are watching this video to watch the video till the end without skipping, and kindly share about this platform to your nursing friends, and whoever didn't subscribe our channel, kindly subscribe and support us. So straight away, without losing time, we are moving to the questions, another 15 questions for the AIIMS NORCET and JIPMER examinations. Straight away moving on to the first question in the present series. So the first question itself is a picture based question, and it's from the musculoskeletal system, and the question is here. So your task is to identify the type of fracture which I have shown in the screen right now. So you have to identify the type of fracture in this picture. Okay, so type of fracture in this picture, and the options for you are option number A, transverse fracture; option number B, oblique fracture; option number C, comminuted fracture; and option number D, green stick fracture. So identify the type of fracture what I have shown in the picture. So that is the first question and the first task for you. So what is the answer? So remember about the type of fractures. So the answer is option number B, that is oblique fracture. Okay, so we will see what is an oblique fracture. So oblique fracture means a fracture of the long bone, and it is in which the fracture line runs obliquely to the shaft of the bone. So here you can see this is the tibial bone, and we can see this is the long shaft of the bone, and the fracture has happened obliquely. Okay, you can see there is a obliquely to the shaft of the bone it has happened. So this is known as the oblique fracture. Okay, so now we will explain about the other type of fractures where I have given in the options, then you will get an idea. So what is a transverse fracture? So in the transverse fracture, we can see that this is the long axis of the bone, and the fracture has happened perpendicular to the long axis of the bone. In the oblique fracture, it was like a oblique. Okay, but here it is pakka transverse, that is perpendicular to the long axis of the bone. So this is the transverse fracture. Now another option was the comminuted fracture. So what is comminuted fracture? It refers to a bone that is broken in at least two places. Okay, so here we can see multiple fractures are there in the long bone. There is a multiple fracture, so the fracture should be termed as comminuted if there is a break in the bone in at least two places, in the same bone in at least two places. Okay, so that is known as the comminuted fracture. Okay, so another one was the green stick fracture. So what is a green stick fracture? Green stick fracture occurs when a bone bends and cracks. So in the fracture you can see the bone is bending here. See here it bends. So here also you can see the bone is bending, and it cracks instead of breaking completely. There will not be complete break of the bone, only there will be cracks instead of breaking into separate pieces. Okay, so there will not be fracture, complete fracture won't be there, complete break will not be there, but there will be a small crack will be there as a result of bending of the bone. Okay, so that is known as the green stick fracture. Okay, so the first question itself is very important and interesting. So now we will move on to the second question. The second question is from the pharmacology, and the question is, which among the following drug is a proton pump inhibitor? So the question is, which among the following drug is a proton pump inhibitor? And the options for you are option number A, pantoprazole; option number B, ranitidine; option number C, misoprostol; and option number D, calcium carbonate. Okay, so all these drugs are one or the other way we are using for the gastrointestinal issues. So your task is to identify the proton pump inhibitor from these options. So the answer is option number A, pantoprazole. So you know that pantoprazole is a proton pump inhibitor, and these are the class of medications that causes a profound and prolonged reduction of the stomach acid production. And the examples are, other examples are omeprazole, then pantoprazole, etc. Okay, so we will move on to the another options like ranitidine. Ranitidine is a histamine H2 receptor antagonist. Then misoprostol. Misoprostol was the synthetic prostaglandin E1 analog, and calcium carbonate can be used as an antacid. Okay, so ranitidine is an histamine antagonist. Then misoprostol, prostaglandin E1 analog, and calcium carbonate is an antacid. Okay, so that's all about the second question. Now we will move on to the third question in our series. This is an application level question, and the question is disposable syringe after blood draw. So the question you should read very carefully. Disposable syringe after blood draw should be discarded in which color coded base? So the question is disposable syringe after the blood flow. Okay, so where you will discard after blood draw. So the options are option number A, red, option number B, yellow, option number C, white, and option number D, green. So just think about the biomedical waste management and answer the question. So don't be confused, because some new guidelines have come. So this question is based on that, and we have given a detailed explanation of this question in our older videos. Okay, so you can go through those videos also. So the answer for the question right now is option number B, yellow. So you'll be confused why that plastic item should go to red, right? But here the question, it is mentioned disposable syringe after the blood draw. So there will be blood stains will be there in the syringe. So as per the new guidelines, all blood stained items, okay, whatever it is, whether it is a plastic, whether it is an IV set, whether it is a paper, whatever it is, if it is blood stained, it has to go to yellow container. Okay, so that is a new guideline. And other options, you know, red are the plastic waste, then white we have to discard the sharps, and green for the food waste. Okay, so as per the new guidelines, all blood stained waste should go to the yellow container. Okay, so don't be confused. Okay, this is as per the new protocols given by the biomedical waste management team. So the next question, the question number 4 is movements or sounds that take place intermittently and unpredictably out of a background of normal motor activity is called as. So read the question very carefully. So movements or sounds that take place intermittently and unpredictably out of a background of normal motor activity. So the question is, during a normal motor activity, in the background there will be intermittently or unpredictably some movements or sounds can happen, and that activity is called as dash. That is the question. So the options are, first one, option number A, Tourette syndrome, option number B, tics, option number C, mannerism, and option number D, seizure. So which are the movements or the sounds that take place intermittently and unpredictably out of a background of normal motor activity? So what is the answer? So the answer is option number B, that is a tics. So you should understand what is the difference between tics and Tourette syndrome and mannerisms and seizure. That we will explain in the explanation session. So a tic, what is a tic? A tic is a sudden, repetitive, non-rhythmic motor movement. Okay, so you should understand it is a sudden, repetitive, non-rhythmic, it is not rhythmic motor movements or vocalization involving the discrete muscle groups, and these are the movements or the sounds that takes place intermittently and unpredictably out of a background of normal motor activity. So now we will understand, we should understand what is a Tourette syndrome. So Tourette syndrome is characterized by multiple movement, that is motor tics, and at least one vocal tic. Okay, so it is a collection of tics. Okay, that is a Tourette syndrome, and a syndrome should be termed as a Tourette syndrome if it have at least one vocal tic and multiple motor tics. Okay, multiple motor tics and at least one vocal tic. If it is present, then that is known as the Tourette syndrome. Okay, then what is a mannerism? So you know that mannerism means it is a noticeable personal habit, a verbal or other. Okay, it's a personal habit which is a verbal or other, often but not necessarily unconscious, habitual behavior peculiar to an individual. Okay, so this is some habitual behaviors which are peculiar to a particular some individuals. Okay, so that is mannerisms. Okay, so I think that is clear for you. Now we will move on to the fifth question in our series, and the question is, which of the following type of cartilage is present at the joints of long bones? Okay, so just think about the different types of cartilages, then you can answer this question very easily. So the question is, which cartilage is present in the at the joints of long bones? So the options are fibrous cartilage, option number B hyaline cartilage, option number C elastic cartilage, and option number D calcified cartilage. So which cartilage is present at the joints of long bones? So the answer is option number B, that is hyaline cartilage. Okay, so we will have a small explanation regarding this question. So what is a hyaline cartilage? So hyaline cartilage has a smooth surface and it is the most common of the three type of cartilage. Okay, so this is answer for another question. So it is the most common type of the three among the three types of cartilages, that is a hyaline cartilage, and it has a matrix that contains closely packed collagen fibers, making it tough but slightly flexible. Okay, so that is a peculiarity of this hyaline cartilage. So the cartilage, it should allow for the flexibility, so it is flexible, but on the other hand it is tough also, and the toughness is made by the presence of this packed collagen fibers. Okay, so you can see this hyaline cartilage between the connections between the ribs and the sternum, in the nasal cartilage and the articular cartilage, which covers the opposing bone surface in many joints, especially long bones. Okay, so that is a hyaline cartilage. So we will see the other types of cartilages also. So the another one is the fibrocartilage. So what is a fibrocartilage? It is the toughest of the three types of cartilage. Okay, so which is the toughest of the three types of cartilage? That is a fibrocartilage. So this is the answer for another question, and the examples are intervertebral disc, then menisci, between the pubic symphysis and at the junction where tendons insert into the muscles, okay, into the bone. Okay, so these places we can see the fibrocartilage, which is the toughest of the three cartilages. And next is the elastic cartilage. So what is an elastic cartilage? So as the name indicates, it is a springy, yellow and elastic, and it is found in the internal support of the external ear and in the epiglottis. Okay, so two structures you can remember: EE, that is in the external ear, and in the epiglottis we can see a cartilage called as the elastic cartilage, which is springy, yellow and elastic. Okay, so that is another type of cartilage, and I think we have explained about the three types of cartilages in this session. Okay, so now we will move on to the sixth question in our series. This is from the ophthalmology, and the question is, removal of entire eye excluding scleral shell is termed as dash. So the question is removal of entire eye excluding the scleral shell. So question, you should read carefully. Excluding scleral shell, that is a question for you. And options are option number A, enucleation, option number B, evisceration, option number C, exenteration, option number D, orthoptics. Okay, so what is the answer? Removal of entire eye excluding scleral shell. Sclera is not removed. So what is the answer? So the answer is option number B, evisceration. So we will see what is the difference between enucleation, evisceration and exenteration. Okay, so enucleation, what is enucleation? Enucleation, it is the removal of the eye that leaves the eye muscles and remaining orbital contents intact. Okay, so in enucleation the eye will be removed, and what all things will be preserved? Eye muscles and remaining orbital contents, that will be preserved in enucleation. Okay, so then what is the evisceration? Evisceration means it is a surgical technique by which all intraocular contents are removed while preserving the remaining scleral shell. So scleral shell will not be removed, then extraocular muscle attachments will not be removed, and surrounding orbital adnexa also will not be removed in evisceration. Okay, so only what will be removed? The intraocular contents will be removed, but the scleral shell, extraocular muscle attachments and the surrounding orbital adnexa will be preserved. That is evisceration. That is the answer for our question. Then what is the exenteration? So exenteration, it is a surgical procedure which involves the removal of the entire globe and its surrounding structures, including the muscles, fat, nerves and eyelids. Okay, everything all together, everything will be removed, then that is known as the exenteration. Okay, so please understand the difference between exenteration, enucleation and evisceration. Okay, and one more option was there, that is orthoptist. So okay, these are the professionals or the experts in diagnosing and treating defects in the eye movement and problems with the binocular vision. So that is another name, okay, orthoptist. Okay, so I think that question also is very important, and I think that is clear for you now. Now we will move on to the 7th question in our series, that is from the genetics, and the question is Edwards syndrome is characterized by dash. So the question is Edwards syndrome is characterized by dash. So the options are option number A, trisomy of 21st chromosome. Option number B, trisomy of 18th chromosome. Option number C, trisomy of 13th chromosome. And option number D, trisomy of 15th chromosome. So which one is Edwards syndrome? Slightly confusing, but very important. So the answer is option number B, that is trisomy of 18th chromosome. Then what are the other options? So that we will see, we know that the trisomy 21, Down syndrome, is also referred to as the trisomy 21. Okay, Down syndrome, trisomy 21. Then trisomy 13, otherwise known as the Pap syndrome. It is a chromosomal condition associated with severe intellectual disability and physical abnormalities. Okay, just to understand about this trisomy 21, Down syndrome, trisomy 13, Pap syndrome. Then another one is a trisomy 18, that was the question we have asked, that is the Edwards syndrome, and it is a common chromosomal condition which is associated with abnormalities in many parts of the body. Okay, I am not going in depth into Edwards syndrome, just for exam point of view, trisomy 18, Edwards syndrome. And the last one was the trisomy 15, or otherwise known as the mosaic trisomy 15. It is a rare chromosomal anomaly, principally characterized by intrauterine growth rate restriction, congenital cardiac abnormalities, and craniofacial dysmorphism. That is a mosaic trisomy 15, just for your information. Okay, so in this question we have learned about some trisomies. Okay, I think all these things are very important. Okay, so next we will move on to the 8th question in our series. The question is, which of the following lipid is highly associated with atherosclerosis? Okay, very simple question, but very important and confusing. So which of the following lipid is highly associated with atherosclerosis? And the options for you are option number A, triglycerides. Option number B, very high density lipoprotein. Then option number C, LDL. And option number D, HDL. So what is the answer? Highly associated with atherosclerosis. So all these things we used to check in the lipid profile. So what is the answer for our question now? So the answer is LDL, otherwise known as the low density lipoprotein. So we will have an explanation about these options. So low density lipoprotein, otherwise known as the LDL, is one of the 5 major groups of lipoproteins which transport all fat molecules around the body in the extracellular water. So what is the peculiarity of the LDL? Means LDL delivers fat molecules to the cells. So LDL is involved in the atherosclerosis, a process by which it is oxidized within the walls of arteries. Okay, so LDL is the harmful one. So we are calling LDL as the bad cholesterol and HDL as the good cholesterol, and triglycerides, these are the main constituents of the body fat in the humans and other vertebrates. Okay, I think this terms is very important. LDL, bad cholesterol, HDL is the good cholesterol, and triglycerides is the main constituent of the body fat in humans and other vertebrates. Okay, so I think that question also is very clear. I think we can move on to the next question in our series, and the question is this is another very important question, and the question is, sella turcica is a structure of which bone? Okay, sella turcica. So what is the speciality of sella turcica? You just remember that and you can answer this question very easily. And the options are ethmoid bone, option B parietal bone, option C palatine bone, and option number D sphenoid bone. So where we can see sella turcica? So what is the answer? The answer is option number D, sphenoid bone. Okay, so we will have a picture-based explanation regarding this question. So this is the ethmoid bone, this is the sphenoid bone, and this is the foramen magnum, that opening, and this is the occipital bone. Okay, so we can see this is the sphenoid bone, that is a butterfly-shaped bone we can see here, and here there is a pit. and this pit is known as the cella turcica. Okay, cella turcica. And what is the peculiarity? What is the specialty? So the pituitary gland lies in this space. Okay, so we will have an explanation. The cella turcica, it is a midline depression in the sphenoid bone which contains the pituitary gland and a distal portion of the pituitary stalk. And the cella is covered by a dural reflection, that is a diaphragm cella, above which lies the supracellar cistern. Okay, so just additional information. So this is a part, this is the depression in the sphenoid bone where our pituitary gland positioned. Okay, so I think that question also is very important and is clear for you. Now we will move on to the 10th question, in our series, and the question is, which type of hallucination is more common in delirium? Okay, so the question again should not be confused with the schizophrenia. Usually you can expect questions regarding schizophrenia like this, but my question is, which type of hallucination is more common in delirium? Okay, so the options are visual, option B auditory, option C gestatory, and option D tactile. So which type of hallucination is more common in delirium? And the answer is option number A, that is visual hallucination. Okay, visual hallucinations are common in delirium. So we know that among these, the delirium, the visual hallucination are the most common type of hallucination. Okay, so this is the most common type. Then the most common hallucinations in schizophrenia are, first one is the auditory. So this is an additional information for you. For the schizophrenia, when we concerned about the schizophrenia, the most common hallucination is auditory hallucination, then comes the visual. Okay, auditory, then visual. Then other hallucinations like tactile, olfactory, and gestatory are reported very less frequently. Okay, so you are getting another important information from this question. So I think that question also is clear for you. Now we will move on to the 11th question in our series, and this is a picture based question, another picture based important question. And the question is, you have to identify the disease of this child. Okay, so you have to identify the disease of the child seeing this picture. So the options for you are option number A kwashiorkor, option number B marasmus, option number C edematous malnutrition, and option number D protein deficiency disorder. So I know these options are very confusing, but if you know the difference between two main protein energy malnutrition, protein deficiency disorders, you can identify this answer. So what is the answer for the question? So this is a child with marasmus. Okay, so we will have a small explanation regarding the kwashiorkor and the marasmus. Okay, so a picture based I can explain like this. So this is a baby with kwashiorkor. So we can see a protruded belly, itchy rashes, cirrhosis, all these things. But in the marasmus, there will be prominent bones, will be very prominent, and there will be decrease in the subcutaneous fat and all. So in brief, I will explain 10 differences, the most important 10 differences. So in the kwashiorkor, it develops in the children whose diets are deficient of protein. So kwashiorkor is a protein deficiency disorder, but marasmus, it is a deficiency of both protein and calorie. Okay, so that is the first difference. Here only protein, here protein and calorie. So then age group, then kwashiorkor occurs in children between 6 months to 3 years, but marasmus is under 1 year of age. Okay, then next one is the subcutaneous fat. Here it is preserved, but subcutaneous fat is not preserved in the marasmus because it will be utilized. Then edema is present. You can see that protruded belly, facial puffiness, everything can be seen. The child will be like little puffiness will be there, but in marasmus, this edema is absent. So in kwashiorkor, there will be enlarged fatty liver, obviously, but there is no fatty liver in marasmus. Reason and all I am not explaining because we have very limited time. Then ribs are not very prominent, but here the ribs are very prominent. Then the child will be lethargic, but in marasmus, the child will be alert and irritable. Okay, in kwashiorkor, there will be muscle wasting will be there, which will be mild or absent, but in marasmus we can see that there will be severe muscle wasting will be there. Then the kwashiorkor patient will have very poor appetite, but marasmus patient will have the voracious feeder. Okay, they will be voracious feeder. And kwashiorkor, the patient needs adequate amounts of protein replacement should be there, but in the marasmus we have to provide adequate amounts of protein, fats and carbohydrate, because there are deficiency in the calories also. Okay, so I know I am running little fast because explaining much about this kwashiorkor and marasmus is not possible in our session, so you can refer it later. Okay, these are the main important difference between marasmus and kwashiorkor, and this, at least this much you should understand regarding these diseases to answer our questions. Okay, I think that also is very informative and it is very clear for you now. Now we will move on to the 12th question in our series, and the question is the most common serious complication of barium enema. Okay, so the question is most common serious complication, which among the following is the most common serious complication of barium enema, and the options are: option number A, constipation; option number B, barium intravasation; option number C, bowel perforation; and option number D, colon inflammation. So read the question very carefully. From the question itself you can answer this question very easily. Most common serious complication. So definitely the answer is option number C, that is bowel perforation. Bowel perforation is the answer for the question. So we know that what will be the reason for the bowel perforation: injury to the rectal mucosa or the anal canal due to the enema tip or the retention balloon is probably the most common traumatic cause of barium enema perforation. Okay, understood. So that is the answer for the question. I think that is clear for you. Now we will move on to the 13th question in our series, and this is from the neonatology. The question is: normal hemoglobin level in neonate is. Normal hemoglobin level in neonate. So what is the normal hemoglobin level? Options are: option number A, 10 to 12 gram percent; option number B, 12 to 14 gram percent; option number C, 14 to 16 gram percent; and option number D, 16 to 18 gram percent. So just think about what is the normal hemoglobin of an adult, and for the neonates how it will be, whether it will be decreased or increased. Then you can answer this question very easily. So what is the normal hemoglobin level in neonate? Answer is option number D, that is 16 to 18 gram percent. Okay, so the explanation we will have why this hemoglobin will be more in the neonates, that I am explaining now. So compared with the older infants and the children, term newborns have an increased red cell mass caused by the fetal response of increased hemoglobin production due to, why? Because of the relatively hypoxic intrauterine environment, then because of the possible vasomotor instability and the venous pooling which can be seen in the newborn immediately after the birth. Okay, so these are the reasons why neonates have high hemoglobin level. Okay, so relatively that hypoxic there will be a relatively hypoxic intrauterine environment will be there, then there will be possible vasomotor instability will be there, and there will be venous pooling will be there. So because of these reasons, the hemoglobin level in neonates will be higher than older adults, older infants and children. Okay, so I think this rationale also is very important, and I think that is clear for you. Now we will move on to the second last question from in the series, and the question is: the instrument which is used for the collection of Pap smear is. So you know that what is a Pap smear, and the Pap smear rules out the cervical cancer. So I am giving you some clues. So your task is to identify the instrument which is used for the collection of Pap smear, and the options are: first one is the iris spatula, option number B, Piper forceps, option number C, Neville Barnes forceps, and option number D, Simpson's forceps. Okay, so through the process of elimination, you can easily find out the answer for the question if you don't know the answer also. Okay, so that is a peculiarity. Just for the information, I have added this question. So which is the instrument which is used for collecting Pap smear? So what is the answer? So the answer is option number A, that is iris spatula. Okay, iris spatula. So we will see what is an iris spatula. So this is the picture of the iris spatula. So this iris spatula, it is a device which is used to collect the Pap smear, and it is a wooden spatula. This is made up of wood with U-shaped opening on the one side. Okay, you can see a U-shaped opening on the one side and a flat surface on the another side. Okay, there will be a flat surface on the another side. So I am not going in depth into the procedure. So this is the instrument, this is the device, that is iris spatula. Okay, so the other options what I have given is quite confusing, so that I will explain now. This is a photo, this is an image of the Piper forceps. Okay, this is Piper forceps, so this is used in the delivery of the aftercoming head in breech vaginal deliveries. Okay, if the baby's position is breech, and if you are attempting a vaginal delivery, so to deliver breech vaginal deliveries, we are using this forceps, which is known as a Piper forceps, and it is designed to decrease the traction on the fetal neck during the breech delivery. Okay, so that is the purpose. And don't be confused with the other options which are going to come. So this is for the breech vaginal deliveries, Piper forceps. Okay, so next one is the Neville-Barnes obstetric forceps. This is a Neville-Barnes obstetric forceps, and it has a cephalic and pelvic curve. It has a both cephalic curve also is there, and a pelvic curve will be there, and it is used for the delivery of the babies presenting as occipito-anterior. Okay, so this is used for delivering babies in the occipito-anterior position. So that's why there is a cervical curve also will be there, and a pelvic curve also is there in the Neville-Barnes forceps. And another forceps, this is the Simpson's forceps. This is the most common forceps which are used for the vaginal forceps deliveries, and it has an elongated cephalic curve. Okay, the cephalic curve will be there, and it will be slightly elongated. Okay, so definitely you will be confused with the pictures, but you should understand the differences and the purposes of these forceps. Okay, so I think with this question you are getting information about 4 obstetrical instruments. Okay, so now we will move on to the very last question in our series. That is a very last question, and this question also is a picture based question, and your task is to identify the mark in the picture. So you have to identify the mark in the picture. You know that it is a very simple and easy question, but don't be confused, because there are chances like you may make the answer for this question wrong. So the options are: option number A, linea nigra; option number B, striae gravidarum; option number C, linea albicans; and option number D, stretch marks. So you have to identify the mark in the picture. So what is the answer? So the answer is, as you all know, this is linea nigra. Okay, so we know that the linea nigra is a physiological form of hyperpigmentation commonly seen in the first trimester of the pregnancy. Okay, so this is otherwise known as the pregnancy line, and it is a dark vertical line that runs down the middle of the abdomen, and it can be one of the earliest indicators of pregnancy. Okay, so this is linea nigra, otherwise known as the pregnancy line. Okay, so that is the answer for our question. The other options, so what is a linea albicans? So this is a linea albicans means you can see whitish or the silverish marks you can see in the skin, especially of the abdomen and the breast, that often follow the pregnancy. Okay, so this is linea albicans. Okay, that whitish or the silvery marks which can be seen in the abdomen and the breast that can often follow pregnancy. And what is the striae gravidum, otherwise known as the stretch marks? So these are the intended or the reddened streaks that usually appear on the skin from the rapid weight gain or from the weight changes. Okay, so this is striae gravidarum. Okay, so this here also you can see the linea nigra here, that is a vertical line. Striae gravidums are the small intended reddened streaks of lines that are usually appear on the skin because of the rapid weight gain or weight changes. Okay, so with that we are coming to the end of this session. So the whatever 15 questions what I have explained today is very important, and I request everyone who are watching this video to make use of this platform, and I request everyone to keep in touch with us, and we will be uploading the next video very shortly. So prepare well. All the best for your upcoming examination, and see you soon on the next video. Till that time, it's bye, signing out. We are signing out. Bye.